Breast cancer is the most common form of cancer in women. Approximately 1 in 8 Australian women will get breast cancer in their lifetime. Nearly 20,000 Australian women and 2 million women worldwide are diagnosed with breast cancer each year. Tragically, over 3,000 Australian women and 600,000 women worldwide will die from breast cancer every year. Hi, I'm Suvi and I'm a journalist based here on the Gold Coast in Australia. And today, my obstetrician and gynaecologist husband, Dr Luke Waldrip, is going to talk to us about what factors increase our risk of breast cancer, as well as teach us ways of how we can be breast self-aware. Can you tell us what factors increase our risk of developing breast cancer?
There are a number of factors that increase one's risk of developing breast cancer. The most important one being age. The older you are, the more likely you are that you will develop breast cancer. Likewise, family history is extremely important, especially if you have a first-degree relative with breast cancer, or if you've inherited an uncommon genetic anomaly, such as the BRCA gene mutation. Increased lifetime exposure to estrogen will also increase your risk of breast cancer, namely commencing menstruation before the age of 12, being obese because this increases your body's estrogen levels, being on the oral contraceptive pill, although this increased risk goes within 10 years of ceasing the pill, and likewise being on hormone replacement therapy for more than 5 years. Somewhat surprisingly, being tall has also been associated with an increased risk of breast cancer, and not having children or having your first child after the age of 30.
That's a long list. Is there anything that has been shown to reduce our risk of developing breast cancer?
Yes, both moderate exercise as well as breastfeeding has been shown to decrease one's risk of breast cancer.
What are the current Cancer Australia guidelines relating to breast cancer?
Cancer Australia recommends that all women be familiar with their breasts and how they look and feel, and that they report any new symptoms, signs or concerns to the general practitioner straight away.
What about screening?
In Australia, Breast Screen Australia will perform routine 2-yearly mammograms on all women between the ages of 50 and 74. They will also perform, on request, a screening mammogram on women between the ages of 40 and 49, or those 75 and above, although these women will not receive an invitation regarding this.
Does screening make a difference?
Most definitely. Screening has been shown to both decrease mortality from breast cancer as well as improve quality of life. In fact, it is estimated in Australia that for every 1,000 women between the ages of 50 and 74 who undergo routine 2-yearly screening mammograms, 8 women's lives will be saved. It is important, however, to remember that it is a screening test only, and it is not appropriate for any new symptoms or signs of the breasts. Women with new symptoms or signs in their breasts or any concerns need to see the general practitioner straight away for a clinical examination as well as referral for appropriate diagnostic testing. It is important to remember that screening will only detect approximately 50% of breast cancers in Australia, therefore the importance of reporting any new symptoms or signs to your health practitioner straight away.
And what about breast self-examination? Is this something we should be doing on a regular basis?
Routine breast self-examination, although encouraged in the past, has unfortunately not been shown to improve overall breast cancer mortality rates. In fact, in 2015, the International Agency for Research on Cancer came to the conclusion that routine breast self-examination was not effective in reducing breast cancer mortality. The Royal Australian Colleges of General Practitioners recommends that all women be breast self-aware. However, they do not recommend routine breast self-examination in asymptomatic women. Likewise, the American Cancer Society does not recommend regular breast self-examination, but that women should be aware and familiar of how their breasts normally look and feel, and that they should report any changes in their breasts to the health practitioner straight away.
So if women are no longer actively encouraged to undertake regular breast self-examination, how are we meant to be breast self-aware?
Breast self-awareness is about knowing what is normal for your breasts. Looking at your breasts in the mirror on at least a semi-regular basis is still encouraged. If there are any changes from what is normal for you, you should see your GP as soon as possible. Changes to be concerned about include a lump, swelling, change in breast size or shape, skin rash, scaling, dimpling or puckering, nipple puckering or discharge, or enlarged lymph nodes in your armpit.
Despite regular breast self-examination no longer being actively encouraged, many women find the concept of being only breast self-aware as somewhat vague and passive. Some women still prefer to perform formal breast self-examination on themselves as an active and empowering health measure. Breast self-examination involves 3 steps: look, lift and feel. Look. Stand in front of a large mirror in a well-lit room with your hands on your hips. Visually examine both breasts from the front and both sides. Check that your breasts are their usual size, shape and colour and that there is no nipple discharge. Lift. Lift both your arms straight above your head. Visually examine both breasts from the front and both sides. Check that your breasts are their usual size, shape and colour and that there is no nipple discharge. Feel. This can be done either lying down or standing up, for example in the shower. Raise your right arm to behind your head. Using your left hand, palpate the entire area of your right breast with the tips of your fingers, from the underside of your breast up to your collarbone and under your right armpit. Using a methodical action, use light, then medium, then firm pressure with the tips of your fingers in each area. Follow a particular pattern to examine your breast, then your nipple, then under your armpit. The particular pattern you use doesn't matter, whether it be back and forth from the bottom upwards, up and down from the middle of your chest outwards, in a circular clockwise pattern, or radiating out from your nipple in a pie slice pattern. Then repeat the process, raising your left arm behind your head and examining your left breast, nipple and armpit with the tips of your fingers of your right hand. Our breasts, like every other part of our body, deserve our care and attention. This October, and in fact every month of the year, I would urge you to be proactive about your health and be breast self-aware. Remember, being breast self-aware is not about following any particular schedule. It's about knowing what is normal for your breasts.